Sure.
and for responding so quickly. You can imagine I'm trying to set up interviews with folks all over the jurisdiction. So that in itself feels heavy. So I just appreciated you writing back so quickly as well and making.
No problem.
So CDC gave PIHOA funding to conduct. Originally, it was more of an AAR, I think, and now since some time has passed, we're doing it as more of a qualitative reflection exercise because we have the quantitative data on the pandemic and the sit reps, and that's all been summarized and published. So the point of this exercise is really to gather insights from key stakeholders in the pandemic response to codify what went well, what could have been improved, and I think given the time that's passed since, what do we need to be including in jurisdictional strategic plans, regional plans like for PIHOA and SPC, et cetera, for future preparedness.
Okay.
So that's kind of the big idea. And so I'm conducting interviews with PIHOA staff, partner staff, health agency staff, current and former, and I'm audio recording, but all the data will be, the transcripts, I'll scrub everyone's names and there won't be any identifying information, and all the data will be aggregated. So hopefully that's helpful. And then the plan is to present a report to the PIHOA executive board sometime this summer. Do you have any questions for me?
No, that's perfectly fine.
Okay, great.
Recording in progress.
So I'm in Honolulu, and it's just for the record, it's April 29th here today. And today I'm doing a virtual key informant interview with someone who worked at USAPI Health Agency during the COVID response. So just for the record, do you consent to participate and agree to the audio recording of your responses?
Sure.
Great, thank you so much. So my first question is, thinking back to late 2019, before COVID, how prepared do you think RMI was for a pandemic on this scale?
Well, it's interesting to note, I don't know what this sounds like, but we were already in the midst of a health emergency, a declared health emergency. We had started our health emergency in August of 2019 with a dengue fever outbreak, and it was really bad. And we had close to 4,000 cases, and if you know anything, those are recorded cases. And if you know anything about dengue fever, it has about a 70% asymptomatic rate. So we had a lot of people who had dengue fever, and our hospital was packed, and it was really awful. And this is my first year as Secretary of Health. I mean, I came in January of 2019. I didn't even know where the morgue was. I was a really unusual choice to be Secretary of Health because it just needed some organization, and I'm really good at that. And I've been known throughout the Marshall Islands for helping people organize. So I just went into this with 750 employees and treating them like they all knew more than I did, because they did. And it was a great learning experience. But then that pandemic, the outbreak in August of 2019 of dengue fever just overwhelmed us. And so pre-pandemic, we were already in an emergency situation and really well organized. We had really good communication. You noted at the beginning of this how quickly I responded. I mean, I've always been like that, and I demanded everybody else be like that too within our organization. So people knew to respond to me very quickly, regardless of what the form of communication was. So and we also, if you remember, in late 2019, measles was sweeping through the Pacific. And we were already dealing with dengue. So we said, look, we did something very unusual. We said, you cannot come into the Marshall Islands. We did this on December 5th, 2019. You can't come into the Marshall Islands unless you show evidence that you either had measles or the measles vaccination. And that upset a lot of people, but we didn't want to fight two diseases at once. And so you move into January, when, just saying, the question was, were we prepared? Well, we were already very well organized and already fighting one disease and trying to prevent another disease coming in. So when January rolled around and we started seeing those videos from Wuhan, we were like, oh my God, now this? So I'll just stop there. I mean, that gets to the point. We were already, like I was saying, the answer is we were probably more organized than most other jurisdictions out here, I would say.
Did you have flu as well? Were you dealing with any flu at that time?
Yeah. I mean, flu is usually a bad thing. And we had influenza A and at one time influenza B come through at the same time that presented just like dengue. It was really just awful what we were going through. And so we were fighting battles on numerous fronts. And the hospital was absolutely packed with people. Every space, we were using closets for rooms. It was bad.
What was that like for you, I guess on a personal level, through this time? Whenever I say to people, I'm doing this review about COVID, a lot of people really share some personal stories about how their physical health and their mental health, was impacted. How was it for you during the response?
First of all, I was surrounded by really great people. Like I said, my approach to this is I was Secretary General of the Red Cross before taking the Secretary of Health position. And the way I treated people was they all knew more than I did. Even my secretary was constantly telling me what I should be doing. And that didn't bother me. In fact, one of the early accusations of me during the pandemic was, why are you listening to your deputy secretaries? And I'm like, because they've been here 20 years and I've been here 12 months. I didn't care what anyone was saying about me. It was personally excruciating. You have to understand that we were the very first country to close the borders. You have no idea what a monumental step that was. And we sat in a room at the Public Service Commission meeting room for 7 hours, convincing the National Disaster Committee to go along with us and close the borders. Because we knew that was the only way we could prevent that disease from coming in here. And we had a really good plan. We were very well organized. For something in the Marshall Islands to be very well organized, it's a bit unusual. And so we convinced everybody. It took us 7 hours, and the government, the cabinet went along with it. The minister was Bruce Billyman. He understood. He was a new minister. It was right at the beginning of his term, but he was listening to us. And the structure of the Ministry of Health is very different than a lot of places in that normally the political structure here in the Marshall Islands is you have a minister, he's politics and money, and then you have the secretary's day-to-day operations, but the minister is more or less the boss. But as soon as a state of health emergency occurs, the Secretary of Health is in charge, because you can't have a politician making decisions that are possibly political. But our minister at the time, and I don't hand compliments out to politicians very often, but he was very good. We all really liked him because he said, Jack, you're day-to-day. Dr. Robert Madison, you're the medical part. I'm politics and money, and stay in your lane. And that was beautiful because we all knew what our roles were. So for me personally, we went, we saw what was happening in Wuhan. We convinced everybody to close the borders. So on March 8th, 2020, we closed the borders. And 3 days before that, my wife had left with my daughter to go to Oregon. My daughter was having sort of a problem pregnancy. She had lost an earlier child to miscarriage. So they wanted to go get better medical care, and they took off. And then 3 days after they took off, we closed the door. So, and she was gone. The baby was born in April, a month after they left. They were gone for a year.
Wow.
So I'm dealing with this horrible thing without, the two people. My daughter lived in my house. So they were gone, and that was really hard for me. We communicated a lot by Zoom and things like that. So, I mean, it was okay. I dealt with it.
Yeah.
And you have to understand here too, the other complicated part is we had a U.S. military base. We have a U.S. military base here, Kwajalein, and we closed the borders. And at first, they got pretty upset, and people from the U.S. Embassy came in. We had to negotiate some things because what everybody quickly realized, and I knew even before we did this, is that the U.S., when it comes to Kwajalein Atoll, they're in charge of everything. They've leased the place. There's only one thing that they're not in charge of, and that's health. And if we have health concerns, we can put any kind of restrictions we want on them regarding vaccinations and whatever. Well, we're in a health emergency, and we said nobody comes in. So think about this, a U.S. military base, 3 months, from March until June, they had nobody coming in, and nobody, you could check out, you could leave, but you weren't coming back. So they were losing people, the contracts were ending, people were having to leave, and they were getting down to bare bones. And, I'm skipping a lot of the story, but you were talking about personal experience. We had to negotiate with the U.S. military and the U.S. Embassy on the idea of getting some of their people in here. And they wanted initially 0 quarantine days in Hawaii and 14 days on this end. And we're like, no. We want 1 week of, and we talk about quarantine, we're talking about you stay in your room, it's monitored, and if you come out of your room, you're out off the trip.
Right.
So we said 1 week in Hawaii, 3 weeks in the Marshall Islands, quarantine. And they didn't like that, but when you understand the laws and the rules, like I studied these like crazy, I knew that we had the authority to do this. And so it wasn't, to me, wasn't much of a negotiation. This is what we're telling you you have to do. Mm-hmm. And I can tell you that one of the U.S. Embassy officials was an anti-vaxxer that I later learned. And she was poo-pooing this whole pandemic thing. And the other part you have to realize, and this was reported by Eldon Alec, who was the consulate in Arkansas, that summer of 2020, for 37 straight days, they had a Marshallese citizen die. And we're hearing that. We're hearing, because as you may know, Pacific Islanders had these horrible comorbidities for COVID. Diabetes, we had one of the highest rates in the world out here. Malnutrition in children. So
37 days. Wow, that's compelling.
Yeah, every day for 37 days. And we're here, and we were getting these pictures of graveyards in Arkansas with all these little RMI flags on them. And they were, and we're such a small community here. We knew these people. I mean, the former president died, and friends died, and in the fall of that year, you're talking about them, we're on the personal experience. This is before vaccinations in October. My brand new grandson, my wife, and my daughter all got COVID. Their whole apartment complex got COVID all at the same time. And we were terrified. My wife's uncle, who was, he was in, I'm a filmmaker. I made a whole bunch of different films, fictional films. He was one of my actors in my films. I was very close to him. He died. He died in the hospital alone, like people did back then. And
where was it?
This was in Oregon, in Salem, Oregon. They were all in Salem. So this was being driven home to us as a very, very scary situation. And we had a lot of people. I can tell you, the day after we closed the borders, I walked into a restaurant, and a guy I normally eat my lunch with, I sit down and he says, "How does it feel to be the most hated person in the Marshall Islands?" And I said, "Well, I'm the Secretary of Health. I've got 42,000 people I have to protect here, and I don't really care what anyone thinks of me," and that was my approach. And so we went through all this, and it was very intense, except for the fact, I'm going to keep coming back to this, is I was surrounded by the people I were working with at the Ministry of Health. Once we made a decision as a group, and that's the way I functioned as a secretary, I did group decisions. We had this core group of people, And once we made a decision, we stuck with it. And I was the mouth. I wasn't necessarily making the decisions on my own. I was the mouth. I had to go out and tell people this is what we're doing. I had to communicate to everybody in the Marshall Islands with the travel advisories and telling people what's going on. And sometimes people would get mad at me from the government because I was going to the newspaper and I was telling everybody everything. And they sometimes they wanted not to have all this information out there, but that's not what I believe in. So I was telling everybody everything because I was watching in the U.S. and then even in Hawaii, people weren't being told what's going on. And I thought, man, that's really wrong. And I didn't care what anyone thought. I was just out there telling everybody what they should know. Yeah, so, I mean, I went through a lot of trauma. I had a lot of fights with people in the government. Some of the businesses here were really upset. The Chamber of Commerce, I have this one really nasty email where they're calling me a nutcase and I have no idea what I'm doing and we got to get that guy out of there and, things like that. And people were forwarding me the emails, which was nice, but not nice. So I kind of knew what people were thinking. But again, and here's something that's important that maybe a lot of other people didn't have as their psychological makeup when they were going through this, is I worked for 30 some years for the people of Bikini as their advocate before moving on to Secretary General of Red Cross and then Secretary of Health. So I've been working for victims of a horrible tragedy out here in the Marshall Islands for a long time. And here I am, Secretary of Health. And I'm thinking, no, not Marshall Islands again. We're not going to be at the bottom of this totem pole. We're going to be at the top. And that was my goal. And I didn't, again, it's really hard to just disregard outsider opinion. When I say outsider, outside the Ministry of Health. But that was my role. We had committee of the wholes where I would have to sit in front of the entire parliament and answer 3 questions from each of the 33 senators. That's 99 questions. It would go on for 7 or 8 hours, and we did that 6 times. It was very painful. But anyway, you want to talk about personal experience. I could talk for the rest of the day about personal experiences. I don't know.
But I'm just imagining you going through all that, and then you don't have your wife and your support system. You're doing a Zoom with a baby and your daughter. Like those supports we all have when we have challenges at work or in general. So I'm imagining that to be extra stressful.
And I had a mantra during this entire outbreak. It was, let the science catch up to the virus. That's our goal. And we rolled in. We were vaccinating people for people in the U.S. And I'm saying this again. I'm glad I brought up the bikini story in the beginning. My wife's a bikinian, kids and grandkids at the Matrilineal Society, so they're all bikinians. I've spent most of my professional life hammering the United States for the tragedies out here. We testified in front of Congress and media people. Every media outlet on earth, I think, has done a bikini story at one time or another. So I spent most of my life hammering the United States, saying how awful they were during this whole tragedy. And that's what I'm sitting in the bikini office right now. So I'm doing it again. But when it came to the pandemic, I thought the United States, and first the Trump administration, and then throughout the pandemic, the Biden administration, they were freaking fantastic. They were extraordinary. We were vaccinating people in December of 2020. My mother's 80. She couldn't get vaccinated in the U.S. until March of 2021. She had to drive 4 hours to do it. Here, you could walk up in 5 minutes and get a vaccination. And the U.S. was sending us as many vaccines as we wanted. We started with weekly CDC calls during the dengue outbreak, and that carried out through the entire. We had 100-some calls over the course of 2 years with the CDC, weekly calls. And it started out just the Marshall Islands, and then it became the entire region. And I can still remember when we closed the borders, everybody calling me insane on these calls with my fellow secretaries and health officials throughout the Pacific. And I had to laugh because within 2 weeks, everybody was closing their borders. Yeah, so I feel really good that we were the first ones.
It sounds like it sounds like what you're saying is the coordination, at least at ministry level, went well. And then, as you just mentioned, the kind of regional coordination, across the jurisdictions was helpful.
Yeah.
Is there anything looking back, could have been improved with that coordination?
I'll say, and I'm trying not to mention too many names here, but Dr. Brostrom and Dr.
Thane.
Thane, yeah, Thane.
They go together. So
I worship the ground they walk on. I mean, we had so much information, and we were so apprised, and they were so involved in getting us information and the vaccines, the testing in the beginning. We were getting, we couldn't test it. We had to wait 9 or 10 days the first time we had a person of interest. And we were all terrified. We thought we had the disease. This was right before we closed the borders. It sent everybody into this awful panic. We had to wait 9 days to get a result back for a test. And it's like, man, this is not good. Get us testing. Every week we were on there saying these guys, get us testing. We don't care what it is. And they got us the testing. As soon as the U.S. had the technology to do it, we had it. And so you had information, you had testing, you had the vaccines, and then later on you had supplies. I mean, just Paxlovid. They sent thousands of doses, which was going against their policy and how expensive that was. So we were just really well prepared. We were the next to the last country in the world to get COVID, which I'm really proud of. The other things I'm really proud of is that in the year 2021, you remember the Delta variant? That was the one that was killing the most people. We were the only country in the entire world that for the entire year of 2021 did not have a single case of COVID, not even a border case. Really proud of that. We were the only country in the world that before we had the outbreak here, everybody from the age of 6 months and up had the ability to get the vaccine. No other country can say that. And the communications, you asked what was weak, or what could have been done better. I thought the biggest weakness in the Marshall Islands was, like, we kept doing these full-scale exercises, and it was frustrating. And again, I won't mention any names or any ministries, but it was frustrating because I thought the Ministry of Health, we took it very seriously, these full-scale exercises, and we were all really well prepared. But these other ministries would show up, and they were very lackadaisical. Some of their people wouldn't come. Some people weren't, they were kind of participating, kind of not, because we were trying to do this real-life situation. I remember one very, very high government official who was participating in one of our exercises, and it was kind of cutting into the lunch hour, and this person said, well, I got to go eat lunch. And that's when I said to the people I was working with, we have to be prepared to be on our own here. We have to be able to do everything. Hopefully some people will help us, but we have to be prepared to do everything on our own. So I thought the weakness for us was our own people and you just couldn't get people motivated. I don't know if that would be the case again or not. But in terms of the outside world, Taiwan, they'd show up at my office every couple of weeks saying, what do you need? PIHOA, they helped us get the Fijian nurses, who some of them are still here. They were fabulous people. I don't know what we would have done without them. When this pandemic broke out, this country had 3 ventilators. By the time we got the disease, we had 40. And this came mostly from people donating things, like the Australians, especially the Taiwanese. They'd show up with coffee, and, these really good coffees, and sit there and, Jack, what do you need? And within 2 weeks, it'd be here. They were donating money. We built an entire COVID isolation ward, both on here and on eBay, before the breakout. We were, these are really state-of-the-art isolation wards that most countries didn't have. Their hospitals were overwhelmed. And when Palau got the outbreak first, the one thing I thought what we were doing that was really good, and Ghaffar in Palau, he and I became very close. I worship the ground he walks on too. But they were in the middle of their breakout. And I said, Ghaffar, can I just have a call with you to just see what you're learning in terms of dealing with the outbreak? And he said, no. You get your people and I'll get mine, and we'll talk to you as long as you want. And we got on this call, and the one thing, most of their early deaths were people who were already in the hospital from suffering from other diseases. So their big message to us was protect the hospital. And so we started doing all these protocols, figuring out these protocols to protect the hospital. So when the disease did break out here, we had no deaths in the hospital. We had 3 people die in the hospital, but they had come in with COVID. It didn't spread in the hospital. We had no hospital spread of COVID. So it was, really well prepared because we talked to people and we learned from what other people were experiencing.
That story is so important, and I think so speaks to the region and how special it is, right? All this cross sharing as the waves hit different jurisdictions and states within jurisdictions. It's just really incredible to hear.
Yeah, and I would say, and I say this to people all the time, I'm actually writing a book I've actually finished the book, but I have to spend about 2 weeks of hard labor to get it together, because I chronicled these experiences. I was getting 200 communications a day at some points, and just tons of information. So it's taken me a while to gather everything and remember all this stuff. I had to do timelines and things. I maintain, I like to say the Marshall Islands had the best response in the world, and I'd argue with anybody. We had a 0.1% fatality rate. We only had 3 people. We had 17 deaths, but 14 of those were, DOAs. They didn't want to come into the hospital. We only had 3 people die in the hospital after having 16,000 cases. I mean, go find anywhere that can say something like that. And I just think as a region, we did great. I know Guam really suffered horribly. I know Hawaii, as far as U.S. states went, they did pretty good, but still they had a lot of issues too. And at that time, the Lieutenant Governor, Josh Green, was communicating all the time. 'Cause, Hawaii was an entry point for us, and that's where we were staging everything. And he was really cooperative, and we shared a lot of information. So we had really good communication throughout the region. I would look, I've been Secretary General of the Red Cross. I've been through emergency. I've been out here 44 years. I've been through different things here, and I've seen emergencies here, and it gets scary here when there's an emergency. Everything breaks down. Communication's awful. You don't have supplies. It's just awful. But I can say that during this outbreak pandemic, I think the rest of the world has a lot to learn from this region and how well we communicated and coordinated. We got Paxlovid in the early days. We never once ran out. We got very, very close a few times. What happens? American Samoa says, we have extra, we'll send you. And in the end, we were sending our extra Paxlovid off to other U.S. We sent some to Chuuk. We actually sent some to Tuvalu, which was a little off the record kind of. I probably wasn't supposed to do that, but I knew I'd met these guys on a trip, and there was just no way I was going to leave them out there without this stuff. So we had some left over. But we had great coordination with the WHO. All these outside organizations, these relief help, it was just really well coordinated throughout the region. I think, I don't know what other people are saying to you, but I think there's a lot to be proud of out here. And I feel, I went through 4 years. We were when you count dengue and COVID, we were in a 38 straight month state of health emergency. I mean, I was only Secretary of Health 4 years. That's 4 years and 3 months. So I was Secretary of Health 51 months, 38 of those months were in a state of health emergency. Yeah. I mean, it's like, and I'm a guy, I had some medical training. I was, at first aid with Red Cross, and I'm a rescue
Right.
driver. But I didn't know much. But the people I was working with, I was one of these. I think they thought I was an unusual secretary because I spent a lot every day. I was in the hospital making rounds every single day, talking to the employees, seeing what they needed. I was doing things I probably didn't really have to do as a secretary. And so I was on grand rounds with the doctors every 2 weeks, which was one of my favorite things to do. So I learned a lot in those 4 years. And by the time this thing hit, I knew the capabilities of the people I was working with. That really helped me in terms of how we coordinated things. But anyway, I don't know what got me off on that.
That's really helpful, and I agree with you, and there is a lot to be proud of, and I think that really comes through when you allow people just to talk about the response and the coordination. In terms of going back to the border closures and quarantine, kind of looking back on that, what are your thoughts looking back on it? You closed the border, it saved, it saved the marshals from COVID coming in, you got everybody vaccinated in time. Looking back on it, is there any, I don't even want to say things that could be improved, but
Yeah.
Is there more information we need? Because obviously some folks were critical of that.
Yeah.
Some people don't.
Well,
you were in the military, but like looking back on it with a, kind of a critical eye, I guess. Do you have any, what additional thoughts do you have?
So the very first border case that we had came in, we didn't have it until, we had a border case in 2020. The very first border case, and that was the Kwajalein missile range. Mm-hmm. And when we looked in, and that's when it was 1 week in Honolulu and 3 weeks here. And when we looked at the situation, we were furious. I mean, how did this happen? And you have to understand too, this is another horrible story that happened. 3 guys went missing on Ebi on a boat, and they wanted to do a search and rescue. And they wanted to land at Kwajalein. We wouldn't let them do it. And there were a lot of people here that were furious with us. But that was when there was no vaccines, and Hawaii was having a horrible breakout at the time. So no way. And one of the guys wound up dying. The other 2, they drifted all the way to Chuuk and lived.
Oh my goodness.
Yeah. I think it was a month or 2 months they were gone or something. But
that's incredible.
Yeah, so we wouldn't let them do the search and rescue. And actually, they weren't even supposed to go out that day. The seas were really rough, and the wives were telling them not to go. They went anyway. But anyway, so we got that first case, and we looked into it, and it turns out that they only spent 5 days in quarantine on the U.S. side. We had to do a committee of the whole that day, I remember. And it turns out when we looked at it, they didn't follow the rules we had set up. So we said, okay, now it's 2 weeks of monitored quarantine in Hawaii and 3 weeks here, and we're going to test you 5 times before we let you into the wild. My wife, when they came back in March of 2021, they had 5 weeks of quarantine with a little baby. Monitored quarantine. You don't go anywhere. You don't go out of your room. 5 weeks. It's like you're in jail. And as I look back now, some people said one of the criticisms, and I would communicate people while they were in quarantine. Some of my friends, some of my fellow secretaries and other people were in quarantine, some of these government officials who would travel. And they were so mad at us and everything else. But, I just kind of said, hey, I'm protecting 42,000 people. This is what we have to do. I would say it's hard for me to find things that could have been done better. And I'm racking it should tell you something that I'm racking my brain.
That's fine if you don't have anything.
Yeah. I thought and as time went on and we had more and more information and we got to the point where we had all the outer island and we had to cover, something the Marshall Islands spread out all over the place. We have these outer islands that are really far away and hard to get to, and you had to do 2 doses. It took us so long, and there was no way I was gonna, not just me, but we were not gonna let up until we felt we were fully prepared, and that meant everybody on the outer islands with 2 vaccines. And the government was driving us nuts about that. I wish That was something I wish we could have done quicker. But we just didn't have, we're a resourceless country here, money wise, health wise, everything. And so that was something I thought I wish we could have done it faster. Because once we got that accomplished, we could shorten the quarantine day. We shortened it, and I got in trouble once because this is during the Delta variant. They wanted to shorten the quarantine days to 1 week in Honolulu and 3 weeks here. And I was like, no, wait till the Delta. We were all saying, the whole Ministry of Health was telling the cabinet, no, wait until this variant's done, because this variant's killing a lot of people. It's the worst one we've seen. We don't know if it's going to get worse. We didn't know where this was going, but they did it anyway. And I was furious. I stood up in a committee of the whole and walked out right at the beginning, saying, I don't agree with this. I'm here to protect doctors and nurses. You don't, the whole entire pandemic, to me, when you look at it, over the world, all over the world, it was public health versus politics. And in those countries, the US, where politics won out, you had horrible things happening. In countries like ours, where public health was winning constantly, we had a great response. And to me, this was a turning point where I just said, this was wrong. I'm not supposed to say this, but I'm saying it. I don't agree with it. And I got up and I left, and they suspended me for 30 days. And I thought I was going to get fired completely. And then the president and some other people stepped in because of the public pressure, and they put me back in there.
And public emergency.
Yeah. I mean, we're in the middle of a pandemic.
Right.
The public pressure on that was the thing that got us through. That was the public pressure. I felt like everybody was like on our side. And that put the politicians in a really weird spot. That they're not in power anymore, and that's why to this day probably some of them would like to see me run over with a truck, but that's okay. But so when they went against us the very first time, I wanted to send a message that you don't do that, and that's why I got up and walked out. And people thought I was like being disrespectful and everything else, but they didn't know that I had a gag order on me. I'm Secretary of Health in the worst part of the pandemic. And I had government officials tell me I'm not allowed to comment on the decision. And I said, no freaking way, man. And I just hung my neck out there, and, they took a shot at me, but public pressure put me back in there. And a lot of the traditional leaders, that was one of the really great experiences I had here, is when the politicians weren't cooperating, the traditional leaders were all on my side. Their job is to protect people like mine. We had very similar interests. And anytime I felt like some politician was really out of line, I just went to the traditional leaders, and they stepped up every time. And I really appreciated that. But I don't know even what the question was, but sorry about that.
You answered it. You're answering them all just in your own narrative way, which is wonderful and appreciated. In terms of traditional leaders, since you brought that up, was there a role there with kind of risk communication and, community engagement as you were going to outer islands and trying to, get vaccinations in arms? How did their risk communication look? And,
well, I'll say this again. We had great communication throughout the pandemic. I thought it was extremely unusual. And what we did when we rolled out the vaccine, on day one, we had the Minister of Health, the Secretary of Health, the Director of Public Health, the head doctor, I forget what we called him. He has the titles escape me, but the guy who's in charge of all the doctors. We had a traditional leader, the judge of the High Court. We just had all these, and we had religious leaders. We had all these people lined up with a big picture-taking ceremony, and we had all these people publicly getting vaccinated, and we were off to the races. It was just an amazing rollout. We did everything the right way, and really proud of all the doctors and nurses. They all were just incredible people. I keep saying that, and I think back to that time, and it's just like everybody was on board. Everybody was working 12, 16-hour days, double shifts. You would think, okay, the disease isn't here, so what's the big deal? Well, we had dengue fever well into March. I mean,
Wow.
that almost lasted for a year here till all the cases cleared. So we were still fighting different, diseases, and it was just the traditional leaders, for example, they all got their vaccines, and they all made it so it was very public.
Right.
When we went up to the information, we went to every single community here in Madron on Ebi, telling people to wash their hands, what to look out for, how to report things. We went to every single one, and we went up to Ebi. I don't know if you're familiar with Ebi, but it's like, a lot of people there, 12, 15,000 people, very crowded conditions. We went up there to present. And I've been to Ebi many times, even as secretary. I've never seen anything like this. We went up there and we said, okay, we're giving a presentation tonight, and there's this one really big vacant lot kind of in the center of the island. And I walk out there, and there's like 8,000 people there.
Wow.
And sitting right up front, as the Euros Lapalap, Michael Kabua, sitting right there with his cane, right in front, right beside us. And it's like, everybody listen. And he stood up and said great things. And this was like unprecedented. We had women. This was when everybody was really scared. And we had women standing up crying, saying, please don't. Because Ebi, think about that, so crowded.
Right.
That disease,
Right.
when it did hit there, ripped through there, and like, the CDC, Dr. Brostrom said we had the fastest spread rate of any country in the entire world by a factor of 7 to 10. I mean, it was like crazy, but we were prepared. Everybody was vaccinated. So the traditional leaders were just huge. And there was one incident where the government wanted to open a quarantine center. You got to think about where these quarantine centers are going to be here. They wanted to open one downtown. And there was one Leroge, a woman Leroge, who wanted to meet with us when we were thinking about this decision. And I was the one that said, look, you can't do this unless you talk to her first, because I knew what she was thinking. And so they did this big presentation, these government people, about how we're going to rope everything off. It's right in the middle where the banks are and some restaurants and hotels and, big center of the population. And they did their presentation, and then this old woman says, it's funny, she said in Marshallese, look, you can't do this down here. That's my final decision. And then she used the English word, period. And that was it. The meeting was like, duh. She goes, you can go and build a skyscraper. Wait, we wound up building the quarantine center. We used a college branch campus way out of that. It's 20 miles out of town. Actually 25 miles out of town. And she says, you can build a skyscraper there. That's my land too. I'm a traditional leader. You can build a skyscraper out there and put people in there. You're not doing it downtown, period. And that was it. It was over. And I looked at the person who, was kind of one of the people who were trying to push it. And I wasn't necessarily against it. I mean, I think we could have done it. But this person just looked at me and said, okay, meeting's over. I mean, we were done.
That's a great story. How did you deal with misinformation coming in? I mean, you mentioned someone at the embassy and the folks within who had some misinformation, but how did you deal with that? I mean, I've heard from a lot of people, a lot of the disinformation came from, folks in the U.S.
Yeah.
saying things,
Again, this U.S. Embassy official that was in our initial negotiations said, look, I have this app from Johns Hopkins. Your chances of getting COVID are 0.111%. And, she's reading all these statistics out. And I'm just sitting there thinking to myself, yeah, but what we say goes. So say whatever you want. I didn't say that to her, but I just listened very, And then I said, no, this is what we're going to do. And it's funny because I was really aggressive. There was a colonel there and these U.S. Embassy officials, and we broke for lunch and with my Ministry of Health people. And they were all looking at me like, man, you've got cojones.
Right.
They were just like, kind of like, wow. Because I don't think any one of them could have said some of those things. But I was just like, this is what we're going to do, and that's it. But there was my tact for misinformation was nip it in the bud. We would do press releases in English and Marshallese. Anytime I heard anything, we would issue press releases instantly. Mm-hmm. And radio, and we had press conferences all the time where I speak Marshallese, but I had my deputy secretary in charge of public health. She was the one who I put in charge. As secretary, you had to play to people's strengths, and you had to get your ego out of everything. And she was doing the weekly broadcast. Maybe it should have been the secretary, but she was great, and she spoke. She could speak Marshallese and communicate better than me, and that was the goal there. So you had to stand aside and let these people do things, and there was a lot of misinformation. But I'm telling you, this is a great example of how the community was really behind us. We were having boats coming in, supply boats. We had this whole big protocol, no human-to-human contact. We lived a completely normal life for 2 years. Kids never missed school. Nobody wore masks. It was normal life. Everything was in the stores. The big concern in the very first committee of the whole was, how are we going to get chicken? It was a committee of the whole. The initials are COW, cow. And the Marshallese word for chicken is bow. And at one point I said, hey, we're hearing a cow and all we're talking about is bow. We're only worried about getting chicken. We will take care of that. We have protocols for these container ships. And in the beginning, we made them sit outside the lagoon for 2 weeks. 2 weeks before they could come in. Yeah. And eventually we shortened that when we got better at the protocols and we figured out how we would do things. But we had a lot of issues with, there were times when the best example I could think of that I thought this was astounding. You have to understand Marshall Islands matrilineal culture. The women are everything here. Men don't, I lived on Outer Islands for 6 years, and my theory was keep the women happy. The men don't matter. You can do whatever you want with them, but the women, you got to make sure they're okay with what you're doing. So this boat comes in, a fishing boat, and they weren't allowed off the boats. They had to stay they weren't even allowed off, period. Unless if they got off, they could do quarantine, but there were all these wacky procedures that we had in place. Well, this one guy jumps off a boat, swims to his house, and his mother calls the police.
Oh, gosh.
I mean, that, having lived here this long, having a mother call the police on their son, that to me is like, that's how much this community was like, we're not dicking around here. We're taking this seriously. We don't want this disease.
Public health,
public
champion,
health.
right there, right?
Yeah. So and the other big incident that happened right at the beginning, and this really cemented me as somebody, everybody, I made the announcement to close the borders. We made all these really good decisions at the beginning, and it just so happened they were all right. So we were looking good. And at one point, this container boat comes in from Fiji, and they didn't do the required time outside. They just came right in. And we had a big debate in our National Disaster Committee about whether or not to let this boat come in at all when they were requesting to come in when they were on the way here. And I was saying, no frickin' way, we're not breaking protocol. And they were all saying, oh, it's loaded down with food, we've got to get this boat in here. And so we did this vote in the National Disaster Committee. I'm one secretary among 8 others. And we did this vote on whether or not to let the boat come in after they've done the required quarantine, and the vote was 8-1 against me. And so this vote winds up coming in and not doing the protocol the right way, and an instant committee of the whole. People were flipping out. They couldn't believe this boat came in here. And as it turned out, it had 60 containers, 59 of them empty, one of them had cement. And so these...
How could I not know that?
Oh my God, and the senators were jumping on this like, flies on crap. I mean, they were just so mad that the National Disaster Committee let this boat come in. And one of the senators asked, well, how did this committee vote? How could you let this in? Was anybody against this? Mm-hmm. And the chief secretary had to answer. I was sitting right beside her, the Secretary of Health. And there was this collective gasp. And instantly, there were people coming up to me, shaking my hands, who I knew didn't like me. I mean, I'd go into the supermarkets here, and women I didn't even know were shaking my hand. It was just like, you're the guy we trust. So that was right at the beginning, right after we closed the borders. So the initial decisions the Ministry of Health make, with me being the mouthpiece, really galvanized the public behind us. And that's what led to, that to me is what led to the really good response. Because we had, again, the traditional leaders.
Another good story. What do you think now that it's 2025? What are there improvements that in systems or capacities or whatever that were made during COVID that have stuck? So, for example, in some places warehousing got better, or temperature controlled warehousing, or logistics management, for example. Are there things that you felt like strengthened that have persisted?
I would say the number one thing were those weekly CDC calls, the sharing of information. I know the instant something else like this happens, those calls will be set up again. Yep. And as a region, we began sharing information and learning from each other and making decisions and discussing things. And there were times where I was on those calls. I was so furious with what was going on in the U.S. I mean, my family got COVID, and no one ever came and saw them. No one ever recorded anything. No one came and, told them what to do. They just got it. And it was all these Marshallese were experiencing the same thing. You get it. And no one is tracking you down and doing, trying to figure out where it came from. Everybody just kind of gave up. Yep. And so to me, the information sharing in the region is something I think we'll always remember that's something that will kick into place right at the beginning. Yeah. PHOA now knows all these agencies. They understand how the shipping works and who to go to. WHO, I'll just say WHO was at times they lagged, and they were kind of I don't want to say they were helpful, but they were a disappointment in that it seemed to be like they were, I don't know how to say this in a diplomatic way, constantly covering their rear ends. For example, when they helped us draft the first travel advisory closing the borders. And they had a legal person there, and the entire time we were drafting that, they were saying over and over and over again, border closures don't work. Border closures don't work. You guys probably shouldn't be doing this. And I just had to keep saying, well, help us finish this, please. Help us finish this draft. And you know how hard it is to be Secretary of Health and have all my fellow deputy secretaries and doctors sitting there, and we'd go on mute and say, we're not listening to these people. This is the World Health Organization. We're not listening. We're not going to do what they're telling us. We think a border closure will work. Mm-hmm. So that was something that, I think one of the main things we did that really helped us was we were making decisions that were right for us. Yeah. And so when you had a lot of outside information coming in from the U.S., shoot yourself intravenously with Clorox. You had all this weird stuff. Take I forget what the drug was, the horse tranquilizer.
Yeah. Yes.
I can't remember the name of it, but anyway, all this weird information coming. I
The
got
J&J vaccine. Remember that? The J&J vaccine, the one dose. There
yeah.
was all of that.
We did that with one island here, and and then after we did it, they had those issues, so we just stopped using it right away. But we had to constantly monitor that kind of information, to make sure things, you had to sift through things, which is really hard to do when you're out here in the middle of the Pacific. But thank God for the US CDC and Dr. Thane and Dr. Brostrom, those guys. And at the end, when we did kind of like an after action review in front of the entire parliament, we thought they were going to come in here and crucify us, but we designed this. We did a very long presentation first showing all the statistics, how we rank in the world, and then we had Dr. Thane and Dr. Brostrom get on there and say the Marshall Islands was the best and without precedent. And slowly the politicians began to leave the room. There were no footholds. There were no political footholds in all of this.
Yeah.
So, you think back, and I just think a lot of those things we did, I know I remember them, and I know the current Secretary of Health, Francine Wasi-Jacklick, she was a deputy secretary at the time. She remembers all that stuff. So a lot of these things got institutionalized. I just don't know what happens when it goes by 10 years.
Right.
And you got these big changeover of people and doctors and officials and everything else. Are they going to remember what we did?
Right.
That's why I'm writing the book, by the way. I think people have to remember a lot of these nuances and things that happen.
I appreciate that, and it leads into my last question, which is, what do we need to prioritize in terms of preparedness for future public health emergencies? So I think you mentioned that, the HR challenges of high turnover, either in terms of folks retiring that went through this, the more time goes on, or leaving with the brain drain. But what else do you feel like, for strategically planning as PIHWA or as RMI or other jurisdictions, what things need to be prioritized for future preparedness?
They should be prepared to have surge nurses. I'll say this again. My daughter's married to Fijian, so I'm a little biased. But those Fijian nurses that came in here, they were so highly trained and had such good work ethics. They didn't. Sometimes there were issues, culture bumps. Fijian and Marshallese. Sometimes but I wouldn't tolerate that. There was no. We're all medical officials here. Don't give me this Marshallese, Fijian crap. I don't even want to hear it. When every once in a while someone would start bringing that up. So no. Same team. Don't talk to me about it. We had Filipinos. We had people from India, doctors. Nobody was allowed to step over those lines. And here I am, a former American sort of as Secretary of Health. It just wasn't happening like that. And I think having the surge protection, the nurses, because I just remember how terrified, which led me to get really upset at the cabinet at that time and get suspended, how terrified the nurses and doctors, they had to go home to families. After taking care of these other people, if that disease broke out, they had to go home to their own families and possibly subject them. And they were seeing all the videos online of these poor American nurses flipping out and crying, and it's just like, the personnel is the most important thing in the medical world, getting those nurses and some doctors if possible. I thought it was great the way, I don't know that we lost any doctors. I can't remember anybody resigning and leaving. We all stuck together. It was an amazing event. It's not so much anymore. We've had a lot of people leave now. I think that's just medical world turnover, especially out in this part of the world. But standing by with that, we instantly needed masks and things like that. That became a huge concern right away. Then we started getting container loads of masks. We probably still have them.
Yeah, rotting somewhere.
Yeah, we got
I know.
we had, and bless their hearts, we had all these Marshallese communities in the U.S. send out container loads of stuff that arrived when we were done with the thing. So it was like, well, thanks, and we really appreciate it, and we made sure we thanked everybody, but we didn't really need them anymore. But getting those kinds of things, like suddenly we needed that stuff to get here, and Taiwan was great. Some other organizations in New Zealand just said, "Here's $700,000." We're a country we had just been fighting dengue, which was really expensive. It's an expensive disease to fight. You have people crowded in your hospitals. We're handing out, mosquito repellent. We're cleaning up areas here. We're going to outer. It was cost us a fortune, and then we went right into COVID, and the country was broke, and we didn't have money. So we got a lot of money coming in, and that really wasn't my area, but it was really helpful. So having emergency funds available, I think, is another really big thing for countries like ours. There's always I forget what they call it, the DAEF funds and stuff, but it's such a small. It's like $400,000 or something, which is, in a pandemic is a dime. It doesn't put a dent in anything. But I would say those things. I don't know. I think what was it called? Operation. This is Trump administration. I'm going back to now. They called it Operation something or other. Hailstorm, not hailstorm. It was.
I don't remember either.
Yeah,
it's funny.
It had a name.
I remember Deb Burkle, the PEPFAR lady, standing. I mean, I can visualize those press conferences. I can't remember. Warp speed.
That was it.
That's it.
Yeah. we had warp speed for 2020, and again, everybody, Donald Trump, but warp speed I thought it was great. They got the vaccines done, and we got information, like I was saying, and we had maybe monthly or every 2 months a call with the White House where we could get on and talk to the head guy. I forget his name. I'm sorry, I forgot. It's 2 years ago.
I forgot his name too. I'm surprised they didn't take more credit for that, to be honest.
Yeah, I mean, in this region, in the U.S., it was a disaster. All the misinformation and poo-pooing everything, but out here in this region, the U.S. was like I say, it's very hard for me to say anything nice about the United States because of my position with the people of Bikini. They were extraordinary. So coming from me, you can't get a better compliment for the United States of America. Coming from me, saying just all around, both administrations, and politics out of the way. Both administrations were extraordinary. Yeah.
Well, thank you for sharing all of this.
Yeah.
It's,
I love talking about it.
And this is a fun job for me, right? I get to to listen. Talk to people.
It's funny.
I'm glad you're writing a book too. I definitely look forward to reading it.
It's only been 2 years or so, but people have forgotten about it, and they don't even want to talk about it. So I never get to talk about it. And I'm doing different jobs now, and I'm not in the health world so much. I'm part of ASTHO's alumni, and I'm on one of their committees, but which I really enjoy. But for the most part, I'm out of that world now, and it's kind of a bummer. People aren't remembering. Every March 8th, I call it Border Closure Day. It's on my calendar. Right. It's like that's the day I went through holy hell.
International Women's Day and Border Closure Day.
Yeah,
right?
Border Closure Day, March 8th. Man, I always remember that day. Yeah, it was really a big thing for us. Taking such a bold step that no one else had done. I mean, that's out of the box.
How old's that grandkid now?
He's 5.
5.
Yeah. And
he's back in the Marshall?
Yeah, and he wanted to have COVID 2 more times after that. I've had it 3 times. But, it was like nothing. It wasn't even worse than a flu. because we're all vaccinated. So he's okay and everything, but his father was here in the Marshall Islands when he was born, so he didn't get to see his son for a year. So this kid to this day is super attached to his father. His father for a long time couldn't leave the house without him flipping out. So things like, little things like that are left over. It's not so much anymore, but.
Are you including personal stories like that in your book?
Oh yeah,
Okay.
The way you read this thing, the entire thing is a personal story.
No, I'm definitely excited to read it.
Yeah.
I'm glad. Because like you said, we need to document. I think that's why people is doing this a little bit too, like beyond the sit reps, and we know what the waves and region did well, but kind of codifying, all of the things that really did go well.
And the way human beings rewire themselves when they go through something like that, they tend to I don't want to think about that awful time anymore. But it was a time to me of being surrounded by heroes and great people, and I think sometimes someone's going to want to look back and say, hey, what the hell happened? And out these little islands during COVID. And I'm really
having each other's backs, totally. And
I want this to be out there, so I'm gonna.
I appreciate your sharing out the CDC too, because now that it's being dismantled, but it is just the more you hear about this, you're like, gosh, how important.
You wait. They're dismantling a system that had already more or less had problems. And now they're making it worse. So the next time this happens, that border's getting closed really fast.
Yeah.
Before
March 8th.
Yeah.
Right. Yeah. Right.
Yeah, it's like, man, it's going to be really scary because I don't even, could they do warp speed again and do these vaccines?
Yeah.
They're losing all, they keep making these analogies to Nazi Germany, but what happened in Nazi Germany? All the intelligent scientists and everybody left. Einstein and a lot of the people that worked on the atomic bomb in the U.S., they all left. And I think what's happening in the U.S. government, all these great people, you humiliate. That's why I'm not Secretary of Health. My last day should have been 2 or 3 days ago. My contract got extended, but I started fighting for the Bikinians. There was a huge financial scandal here, and I was writing to high government officials, but I was Secretary of Health, which they didn't like. So they didn't want me to be Secretary of Health anymore, and I just said, I'll see you later. If you're not understanding the crisis we're going through, I'm not going back to government again because of what they did. And I know, and I'm on these calls, these alumni calls with ASTHO. I don't mean to keep going here, but it's important to note this. I'm on these ASTHO calls with alumni, and usually it'd be about 20 or 30. Now it's like 70, 80 people every month. Now they're doing monthly calls, and you have people in tears because they're being thrown out of their jobs. And these are people who, I know some of them, I relied on them. And I'm thinking, well, who the hell am I going to, who are they going to go to when this guy's gone, or this woman? And they're being thrown out because they're African American. It's just crazy. It's like they're setting themselves up for the end of the world or something. I don't know.
Really. And I also just worry that, as someone that's been in public service, how is that attractive? Who, in terms of the new workforce, you watch this happening. You get rid of all these, talented people, but as a young, are people going to go study public health?
Yeah.
Are people going to study environmental health and see that as a career that's wonderful and mission driven? I think that worries me too.
Yeah, and my son is in his second, finishing up his first year of medical school, and I can't afford that. It's student loans, and I'm thinking, is this guy going to be able to graduate? They're talking about doing all these things to the education system too, to the training of these medical people. And I'm saying he has enough money for the first 2 years, but the second 2 years are still up in the air. And I'm thinking, oh my God, how are we going to do this? It's going to be really touchy. It's horrifying.
Yeah, especially when we're talking about with preparedness,
Yeah.
and also the disease, the global health security work. I hope even if CDC is not doing it, the Department of Defense, I hope someone's doing it, will continue that work, because
But see, that's the key point that you're making is we're not going to know who to go to. It's going to be, at least with the CDC, and even though, during the Trump years, they were trying, the first Trump administration, they were trying to do all these awful things to CDC. And I know some people who quit CDC personally because of what was going on. They didn't like it getting so politicized. Not the idea of not recognizing that as an organization is, wow. It's terrifying, but we know that.
But it's nice to reflect on the COVID response and again, codify how well it went in many regards.
Yeah.
So,
yeah. Thank you.
well, thank you so much.
Yeah.
It was really nice to meet you.